I'm Kirsty, I'm from Brighton originally, although I'm living in Manchester at the moment. I'm studying at the University of Manchester for a PhD in criminology. When I'm not studying, which seems to be all the time, I'm walking my dog. I live quite near the Pennines, so I'm quite often up there. I enjoy cycling. In hindsight, although I wasn't probably aware in my teens, I've experienced symptoms of bipolar type 2 since my early teens. Day to day, it can, if I struggle to get up in the morning, it can be really difficult. Then it can be difficult getting started. If I'm feeling particularly low, my sort of version of self-harm, if you like, is sort of self-neglect. So I perhaps won't wash for a couple of days, and I won't eat properly, I won't do my work, I won't go out of the house and see people. And then other times I can be manic and working 20 hours a day, being productive in inverted commas, because usually the outcomes or outputs aren't particularly good. So a crisis to me feels like utter despair. Those rational thoughts of not wanting to actually hurt yourself or be alive, they disappear. It's almost like you can imagine all the ways that other people would be better off, and that the pain goes away, I suppose. My mood had dipped so low that I had sort of one particular day and evening that was what I would describe as a crisis. Nobody was really around, and all I really remember is crying hysterically for hours. I remember distinctly feeling on that night, because I'd been sort of hushed away from A&E, that I couldn't turn to them, and I didn't really know of any other services. Whenever I'd spoken to a GP or anything like that, they'd always said, go to A&E, or if it's in working hours, you can call us for an emergency appointment. There's one particular service that's opened relatively near to my home in Manchester, which is open from 9 p.m. till 9 a.m, but I know they've only got 5 beds, so I'd still probably think, I'd have to be about to do something in order to access it. On several occasions, mental health and health professionals missed opportunities to perhaps do more than just give me a tablet and say, off you go. Really. It's not available 24/7, the services that I would like, I think, to access. So something that can come to you regardless of the time, and not necessarily just be a service that, monitors your medication, something that can give you some more immediate sort of help with the crisis that you're facing at that moment. I think to have a sort of dedicated member of staff that's able to look after somebody who's in crisis, plus also just having enough beds. I mean, too many people in crisis end up in police cells when they should be in a sort of health setting. So a dedicated member of staff that doesn't offer judgment and sort of observation, and a psychiatrist or something along those lines available 24/7, much like with physical health.